Understanding depression. More than just sadness. Depression is a serious mental health condition that affects millions of people worldwide. It's more than just feeling sad or down from time to time. Depression is a complex illness that can have a profound impact on a person's thoughts, feelings, and behaviors. It can affect their physical health, relationships, and ability to function in daily life. Despite its prevalence, depression is often misunderstood and stigmatized. Many people suffer in silence, feeling ashamed or afraid to seek help. It's crucial to remember that depression is a medical condition, not a sign of weakness or a character flaw. By understanding the nature of depression, we can begin to break down the stigma surrounding it and encourage those who are struggling to seek the help they need. This essay will delve into the nuances of depression, exploring its symptoms, causes, and available treatments. It will also provide guidance on how to support loved ones who may be experiencing this debilitating condition. The difference between sadness and depression. It's important to distinguish between temporary sadness and clinical depression. Sadness is a normal human emotion that everyone experiences from time to time. It's usually triggered by a specific event, such as a loss, disappointment, or setback. Sadness typically subsides on its own as the situation improves or as time passes. Clinical depression, on the other hand, is a persistent and pervasive mood disorder. It's characterized by a persistent low mood, loss of interest in activities that were once enjoyable, and a range of other emotional, cognitive, and physical symptoms. These symptoms can last for weeks, months, or even years, and can significantly interfere with a person's ability to function in their daily life. While sadness is a natural part of the human experience, clinical depression requires professional attention. If you are experiencing persistent feelings of sadness, hopelessness, or despair, it's essential to reach out to a healthcare professional for diagnosis and treatment. Symptoms and physical effects of depression. The symptoms of depression can vary from person to person. However, some common signs include persistent sadness or low mood, loss of interest or pleasure in activities, changes in appetite or weight, sleep disturbances, fatigue or loss of energy, difficulty concentrating, feelings of worthlessness or guilt, and thoughts of death or suicide. Depression not only affects a person's mental and emotional well-being, but also has physical manifestations. It can disrupt the balance of neurotransmitters in the brain, leading to changes in mood, sleep, appetite, and energy levels. Studies have shown that people with depression may have structural differences in certain areas of the brain, such as the hippocampus and prefrontal cortex, which are involved in mood regulation and cognitive function. Furthermore, depression can weaken the immune system, making individuals more susceptible to physical illnesses. It can also increase the risk of developing chronic health conditions, such as heart disease, stroke, and diabetes. Seeking help and supporting loved ones. If you suspect that you or someone you know may be experiencing depression, seeking professional help is crucial. A healthcare provider can make an accurate diagnosis, rule out any underlying medical conditions, and recommend the most appropriate treatment plan. Treatment for depression typically involves a combination of therapy and medication. Psychotherapy, such as cognitive behavioral therapy or interpersonal therapy, can help individuals identify and change negative thought patterns and develop coping mechanisms. Antidepressant medications can help regulate brain chemistry and alleviate symptoms. Supporting a loved one with depression can be challenging, but it's essential to remember that you are not alone. Offer your support and encouragement, and let them know that you are there for them. Educate yourself about depression so that you can better understand what they are going through. Avoid making comparisons or minimizing their experience. Remember that depression is a real illness, and what they need most is your empathy and understanding. Encourage them to seek professional help and offer to assist them in finding a therapist or psychiatrist.